So in the RCH phase 2, that is the reproductive and the child health program phase 2, we are mainly focusing on decreasing this maternal mortality rate and the infant mortality rate. So this is started in 2005, April 1st. See, under this phase 2, you are going to run about 4 things. One is this essential obstetric care. Second is the emergency obstetric care. Third is strengthening the referral systems. And fourth is training of MBBS doctors in anesthesia. You can understand better if you see this RCH phase 1 video which I have made. So in the phase 1 of this essential obstetric care, we are mainly focusing on 4 things. One is ANC, PNC, institutional delivery, and the registration of pregnancies, right? So here we will be mainly focusing on this institutional deliveries. We will be improving this institutional deliveries in the phase 2. We are converting 50% of this PHCs and CHCs into this 24-hour delivery system. And in states like Andhra Pradesh and Tamil Nadu, they have included 3 to 4 staff nurse or auxiliary nurse midwife at the 24-hour service centers in the PHCs. And also we are including this skilled attendant at the delivery. So we are providing skilled attendant and also proper referral services. And also we are teaching this ANM or the auxiliary nurse midwife to use drugs in case of emergency pregnancies and all. Guidelines are given to medical officer, ANC, and also auxiliary nurse midwives at the PHCs and CHCs. Now coming to the emergency obstetric care, here we will be mainly focusing on this first referral units. In the phase 1, we have provided the first referral units with some obstetric kits and the emergency kits and all. But here we will be providing 24-hour delivery services. We will be having this C-section. We will also include the C-section under this emergency surgeries. We will include newborn care and sick child emergency care, family planning, treatment of STDs, referral services, blood storage facilities, and the lab services. So just remember these 3 things. One is emergency surgery, newborn care, and blood storage facilities. These 3 are the critical determinants of this FRH. And in the first referral units, there should be 20 to 30 beds, functional OT, functional labor room, and you should also have this equipment, laboratory, blood storage facility, 24-hour electricity and the water supply, waste disposal, and the ambulance, right? So 20 to 30 beds, 1 OT, 1 labor room, 1 ambulance, and equipments and the laboratory, blood storage and all, and also water supply, electricity, and the waste disposal. So only if you have all this, it can be known as this first referral unit. And the third intervention is strengthening this referral services. In the phase 1, we have used this panchayats to strengthen our referral system, but it did not show any much of the result, right? So this time we are including the self-help groups, NGOs, and the female groups, and for the RCH too. Coming to the last intervention, which is training of MBBS doctors. So under this intervention, we are just taking this MBBS doctor and we are teaching them anesthesia. How to give anesthesia in case of emergency C-sections, right? If there is no doctor available, MBBS doctor can give this anesthesia, right? It is not to replace any anesthetist, but it is useful in the emergency C-sections. So it is useful in emergency obstetric care. Here 16 weeks program or the training program is given for this MBBS doctor, in which life-saving anesthesia skills are being taught to MBBS doctor in the 16 weeks program. So what are you doing under this training program? 16 weeks you are teaching this MBBS student on this anesthesia and all. In case of there is emergency obstetric case or this emergency C-sections, he can go and perform this anesthesia skills and all and can save the patient. If there is no doctor present, it is not to replace any anesthesiologist, but it is useful in the emergency C-sections. So if we summarize the whole thing, under this RCH phase 2, you are mainly focusing on decreasing this maternal mortality rate and the infant mortality rate, right? So here main interventions include this FRU improvement and also 24-hour delivery services, right? Again, you have this 4 interventions. One is essential obstetric care, emergency obstetric care, teaching the MBBS doctors and anesthesians and all, and also strengthening the referral services, right? So if you see the first one, where you have this essential obstetric care, you will be focusing on institutional deliveries by converting this 50% of PSCs and CSCs into 24-hour delivery system. So we have learnt about this point, 24-hour delivery system. And not only you are providing this 24-hour delivery services, but also there should be a skilled attendant at the delivery, right? So you will teaching this ANMs and all how to use the drugs in case of emergencies and all, right? So this is about essential obstetric care, under which you will be learning institutional delivery, 24-hour services are being provided in the PHCs and CHCs, and also a skilled attendant is being provided along with this 24-hour services. So this is done. Coming to the second one, which is emergency obstetric care. Here you will be focusing on this FRUs. In case of phase 1, we just provided FRU with some obstetric kits, emergency kits and all. But here you are providing them with C-section, blood storage facilities, and also newborn care, because we are trying to reduce this maternal mortality rate and the infant mortality rate. So we can reduce the maternal mortality rate by conducting this emergency C-sections and also by providing this blood storage facilities and all. And we can reduce the infant mortality rate by newborn care, sick child emergency care, and also 24-hour delivery services. So write about all these services added to this first referral unit. And out of this first referral unit services, this emergency surgeries like C-sections, newborn care, and blood storage facilities will be the critical determinants. Strengthening the referral systems. So in the RCH one, we have used panchayats for this referral system, which failed. That's why now we are using this local self-help groups and the NGOs. See, under this you have this MBBS doctor who have just passed MBBS. He came into this posting of this PSM and all. For him, you are giving this 16-week course of this life-saving anesthesia skills. Not to replace any anesthesiologist, but just you are giving him in case of any emergency obstetric care, right? So it will be useful in emergency C-sections. So this is training of MBBS doctors in emergency obstetric care and all.